Now let's talk about the hard tissue landmarks on a cephalometric film and on a skull. Let's start with nasion. Nasion is here. It is the most anterior point midway between the frontal and nasal bones on the frontonasal suture. It's here. And orbitale, the lowest point on the inferior bony margin of the orbit. If you see the bony margin of the orbit, the lowest point is here. This was nasion, this is orbitale. And porion, this is the highest bony point on the upper margin of external auditory meatus. You see it here. And this point is porion. It's the highest bony point on the upper margin of the external auditory meatus. When we come to sella, the point represented the midpoint of the pituitary fossa and sella turcica. It's a constructed point in the mid-sagittal plane. Here you see the sella turcica. This is a constructed point called as S and sella. The point A, it's about maxilla. It's the deepest point in the midline between the anterior nasal spine here, ANS, and the alveolar crest. Here is the alveolar crest between the two central incisors. This is point A. And coming to point B, it's the deepest point, it's about mandible. It's the deepest point in the midline between the alveolar crest and the mandible and the mantle process. Here is the point B. Yes, let's go on. When we come to Bayesian, it's the median point of the anterior margin of foramen magnum. We can find it following the sphenoid bone, and it's something like coming the margin. We can say that when we follow this sphenoid bones borders, we can say that Bayesian is here. Anterior nasal spine, it's ANS. It's about the maxillary plane. It's ANS and PNS constructs the maxillary plane. Here is the anterior nasal spine, and following it to backwards, here is the posterior nasal spine, and ANS and PNS both constructs the maxillary plane together. And gonion is also a constructed point at the junction of the ramal plane and the mandibular plane. This is the ramus of the mandible, and this is the corpus of the mandible. Here we construct a line which is tangent to the posterior border of the ramus, and we construct a line here which is tangent to the mandibular border, lower border of the corpus. This is called ramal plane, and this is called mandibular plane. Imagine that there is a plane here, there is a line here, there is a line here, and they intersect here, and the midpoint, the midpoint on the the junction of those two planes on the mandibular bone here, it is called gonion. Yes, let's go on. Pogonion. It is the most anterior point of the bony chin in the median plane. Here it is. Yes, the menton. It's the most inferior midline point on the mandibular symphysis. Here is it. This is menton. And the gnathion, it's the most anterior inferior point on the symphysis of the chin. We can say, here is pogonion, here is menton. The gnathion is just in between them. Yes, this is gnathion. There is articulare, and articulare is the point at the junction of the posterior border of the ramus. This is the posterior border of the ramus, and the inferior border of the basilar part of the occipital bone. It's a point like here. It's called articulare, and the condylion. The condylion is the most superior point on the head of the condyle. We can see, maybe you can see on this film or not. You should have look at more near. You can see it here. This is the head of the condyle, and the most superior and posterior point of the condyle. Here is it, condylon. Yes. and posterior nasal spine we said. And the glabella, it's the most prominent point of the forehead in the mid-sagittal plane. This is the forehead, and most prominent point is here. It's called glabella. And yes. And the soft tissue glabella is also here. It's the most prominent point in the mid-sagittal plane of the forehead. This is the soft tissue glabella, and this is the soft tissue Nasian or Nasian. And the pronasal, now we are talking about the soft tissue points. The pronasal is the most prominent point of the nose. This is the most prominent point of the nose. Pronasale, yes. And sunasal here, you can see, it's the intersection of the lower border of the nose, and the outer contour of the upper lip. This is sunasal or subnasal. Yes. And soft tissue points, soft tissue pogonion. Here, soft tissue pogonion. You can see soft tissue menton here. And yes. Pogonion soft tissue, and then menton soft tissue. And labrale inferioris and labrale superioris. This is labrale superioris, the meeting point in the upper margin of the upper membranous lip. This is it, labrale superioris, and this is the labrale inferioris on soft tissue points. Yes, these are the soft tissue landmarks. Now, let's look at the hard tissue points on a skull. As you can see, a skull here. This is Nasian. You can see Nasian here. And here is the sella turcica. Just the geometric midpoint of this volume of the sella turcica. This is sella, you can see it here. You can see the bone here. You can see the sella turcica. The geometric midpoint of this volume, here it is sella. And you can see anterior nasal spine. Here is anterior nasal spine. You can see it here. The anterior nasal spine. And the A point, or point A here, it's point A. And the B point, you can see here, it's the point B. And you can see pogonion here. You can see pogonion here. You can see menton here. You can see menton hard tissue here. And the gnathian is just in between them. You can see gnathian here. And the gonion, this is just the midpoint of the intersection of the ramal line and mandibular plan line, which is here. This is gonion. And the gonion is here. Yeah, the other points are, let's talk about orbitale. This is the bony border of orbit, and the lowest, deepest point here, this is orbitale, and you can see the orbitale here. Yes, in general, the cephalometric tissue landmarks and points are like that. And in addition to them, there are some planes. For example, for Frankfurt horizontal plane, it is just constructed by the intersection of point orbitale and point porion. The line which is constructed passing through them, for example, let's draw a Frankfurt horizontal by using color black. Yes, this is Frankfurt horizontal plane. We use it so much in orthodontics, so you have to know about it. This is Frankfurt horizontal plane, FHP. And that's all we can say about cephalometrics.